With Dr. Andrew Brown. Dr. Brown, can you tell us a little bit about your professional background with MS?
Well, I first got interested in taking care of patients with multiple sclerosis in my residency program, which was actually at Albert Einstein in New York City. And the reason that I became interested in taking care of patients with multiple sclerosis is you follow patients long term, and there is a lot of impact that you can make. There are a lot of new medications that are coming out that are very exciting, that really seem to have a bright light on the horizon for patients with multiple sclerosis. So I wanted to be part of being able to help care for patients and help to educate patients about what's going on, about their disease, and to hopefully be able to help introduce the older drugs which work and the newer drugs that are coming out. So that's really why it became interesting for me to want to try to help patients with multiple sclerosis.
So you get to build relationships with your patients.
Correct. During my fellowship, which is just extended training that physicians can choose to do, it's not required, but it's something that you choose to do as a physician, to do extra training. I chose to spend a year of time with the University of Miami in their Department of Multiple Sclerosis, working with Dr. William Sharamata to learn more about treating patients with multiple sclerosis. And one of the things that I learned is that the relationships and the foundations of relationships that you build with your patients really do last for a long time. And it is part of making a commitment to take care of patients with multiple sclerosis, that you are available to answer questions and to, if you can, really help guide patients to feeling better. And that's really what I tried to learn in my time with Dr. Sharamata.
And if you had a message for MS patients or family members who might be watching this video, what would you like to tell them?
I would most like to tell them that they're not alone with this disease, and that it sometimes can feel isolating, and that the community foundations available, like the MS Foundation, are a great resource to patients and families for help. I want patients to feel that they can ask questions of their physicians, and sometimes we might not know the answers, but we can look together to find them. And I think that that is important. In fighting this disease, which needs to really have a partnership between the doctor and the patient and the community and the caregivers, it is important to really stress that, and that would be what I would want to tell patients with multiple sclerosis.
Thank you so much, Dr. Brown.
My pleasure.